Hey everyone, I'll be presenting my literature review of artificial intelligence in cardiology. This is a presentation of my literature review findings and conclusions. If it would just load. Uh, One second. Okay, yeah, so I'll talk about the basic overview of this and where I'm going to go. And then, so basically overview of my project, the problem that I was trying to solve by, covering basically, how advanced the literature is in this topic. And then I'll go over the, specific heart disease. So basically, I covered three main heart diseases in my presentation and in my paper. So the first is an irregular heart rhythm. So how you hear the lub dub, the rhythm in your heart that kind of pumps blood throughout the rest of your body into vital organs. And so that's called the sinus rhythm. And it's really common to have an abnormal sinus rhythm as we age because the body starts to lose control of the sinus nodes in the heart. And that can have irreversible effects that can be pretty a pretty formidable consequence. And that's why we need early detection of those type of things. And then we have arterial diseases, which is like a buildup of plaque in these arteries, and the arteries that are just, the pathways around the heart that send blood throughout the body. And having cholesterol plaques forming in these arteries is going to block your blood flow going to the rest of the body. Then you have structural abnormalities, which is weakening of the heart muscle. So like, as you can see the heart muscle over here, you can have that be kind of weakened. And then you can also have valve issues. So like all the valves that kind of pump blood from one chamber to the next, which they can also have issues. So they can cause blood to leak to a different chamber. And then septal defects, so like holes in the walls of the heart. And all of these basically collectively the absence of effective treatment for these conditions can lead to heart failure, which is the cumulative condition of the heart to be unable to pump blood to the rest of the body. And so keep in mind, these are not the only heart diseases that exist today, but these are the main ones that are being applicable to AI intervention. And they are the ones that I covered in my paper. So a basic introduction to AI. I'm pretty sure you all know what artificial intelligence is, right? But artificial intelligence is the algorithm-led program that's designed to solve human decision pathways and solve complex tasks that humans maybe do not have the time to solve. So first, we start off with the umbrella term of AI, and we then, AI uses this thing called machine learning, which is the compilation, the cumulative algorithms that can solve different things. And then these algorithms, these layers of algorithms are called deep learning. So if you feed data to a specific, decision pathway, then each bit of data that you feed, it will start learning off of this data and be able to arrive to conclusions faster, or arrive to more accurate conclusions. And then it uses convolutional neural networks in specific applications. So if I give it an image and tell it to, oh, find the blood clot in this image, then, it'll use the convolutional neural network, skills that it was taught with the data set that we, fed the algorithm. And then it'll arrive to the specific conclusion faster than humans can and more accurately. And so the bottom line is, can AI help improve management of heart disease? So my goals, there's three avenues for the prevention or for the treatment of heart disease. And so the first is prevention. AI in smartwatches, can we use AI to detect things early on and maybe help people move around before they can develop heart disease, before it can go into the later stages? And so then, can we use like these pacemakers to encourage more exercise? So like, maybe if your heart rate is going on the low side, or like there's an abnormality with your heart rate, oh, you got to go to the doctor immediately, like prevention of the progression of disease into the earlier stages. So that's the first one. The second one is detection. So the analysis of data from different imaging modalities. So like the electrocardiogram, the CT and MRI scans for actual, physical abnormalities. And you have nuclear imaging, which is a newly developing imaging, modality. But all of these things, can we use them? Can we use AI to detect specific things, pertaining to these modalities? Then the last one is treatment. So providing accurate treatment options based on statistics, that's what AI does, right? So you have all of this data. So can I get a personalized treatment plan for my patient with all this data? And so that's what it'll do. And AI actually, it's been proven that in some cases, it can reduce surgical error in some situations. And medical malpractice is a really kind of developing problem in our country and in the rest of the world, really. So this is a pretty massive thing. And so I'll talk about my specific applications now, the applications that I covered in my research paper. And so the first thing is the prevention, right? So can we use smartwatch AI to motivate people to exercise more? And so as you can see here, your blood oxygen sensor, which is on the bottom of the smartwatch, has been able to bounce light into the blood, and the amount of light that's reflected back determines your oxygen saturation level. And then, of course, you have your heart rate sensor, which, yeah, it just detects how much blood is being pumped, right? The pulsing motion. And so these smartwatches can detect and interpret these standard metrics such as calories and respiration rate. And based on these calories, they can, give a exercise plan. So like, oh, move. This is your goal for this next day. Can you move this amount of steps today? And so there was a study called the Apple Heart Study that really effectively conducted this, and they partnered up with Stanford to evaluate these Apple Watches, ability to, their ability in the early detection of irregular heart rhythms. And so it takes really a lot off of the surgeon's plate. Like they don't have to see as much people, and they know exactly where the stage of heart disease is, so then they can treat and prioritize patients better. The second thing is, if it loads, detection algorithms. And so, like I talked about, how we can use AI and these different imaging modalities to come to conclusions faster, to detect things faster. And so then physicians don't have to spend hours analyzing these things, and they don't have to have stacks of papers on their desk, going through these medical scans. And so AI's analysis of electrocardiogram and telemetry readings, honestly, has been really accurate so far. There's been very less surgical error and pretty comparable to physicians, but again, there's still that margin for error, right? So the other things that I talk about, the transthoracic echocardiography, the CT, the MRI, and nuclear imaging. And so basically, what all of these things do, right? So these imaging modalities can take specific, scans or specific readings and then produce conclusions based on those. But then you also have these things called all-inclusive decision support systems. And so you have your conclusion here, and it takes into account the symptoms of the patient and the other data that they report in the initial, treatment stage. Then their patient history, what have they had before, what's going on before. Then they have the medical tests, right? So they're like, the tests that they use to determine if they have any specific condition. Then you have your demographics, where they live, how that affects them. And so data inclusive decision support systems, that's Boston University's new hypertension model and the assistant promise tools that help during surgery. And so this is an example of contouring and delineation. So on the left, you can see this MRI scan, and you can see how AI automatically segments these different parts and analyzes them separately, and possibly even more accurately than a physician, but it still has to be checked by a physician. And then on this right, you can see a transthoracic echocardiography model, and you can see how automatically it just goes to those things. Like it knows, like we feed it an image, right? And then we tell it, oh, this is this, this is this, this is this. And then we keep on feeding it multiple images so that it can find multiple scenarios and then apply that into another situation. And so the third is treatment, which I'm not going to go over at all because it's really brief. And honestly, there's not much on this topic at all. And so AI in surgical procedures. So there is some on the accurate event prediction. And so how can we based on the decisions made during the surgery, what is the what is the chance that the patient will survive after the surgery, and how much anesthesia do we administer before the surgery based on previous medical history and based on their problem. Then you have intra-surgery decision support. So like currently in this situation, what do we do? Like what instruments do we use? And so like we're trying to do it, but I like this quote from CMR Surgical that kind of sums up everything. I believe the next step driven by AI will be the augmentation of surgical robots. So, obviously fully automating heart cardiology surgery, and that's really a developing area of research that we still haven't gone into yet. And it's such a developing area that, there will be many inaccuracies, and only the future will hold the best things that we're about to see. And so the final thing is I just want to talk about the future directions of this research and, kind of sum up the areas of improvement for AI. And so in terms of accuracy, there's definitely large margins of error compared to physicians overall. And we can see that, it's starting to break free a little bit in AI's analysis of electrocardiogram readings and, some of the other imaging modalities, including telemetry. But then there's also the big issue of trusting and welcoming AI's contributions. I mean, if I have a heart disease, right? Am I going to let others use AI for my treatment, or do I need a person? And you have the black box problem. So like, how did AI get to the specific solution? It needs to tell me, what's the process, right? So physicians can tell me that easily. And then security issues, like if we're feeding this data to AI, like what's the guarantee that this data is not going to be leaked, or we don't have security issues in the future? And so the final statement is increased research is required to improve existing algorithms. And especially as more data sets become available, we can expedite these processes quicker and come to patients quicker and save lives faster. And so I want to give special thanks to my mentor for this research, Mr. Brandon Lee. And these are my references. I'll take any questions. Thank you.
Awesome. Thanks, Nehal, for sharing your comprehensive findings from your research with us. The first question I have for you is, of all the techniques that you have just presented, which ones are the furthest developed and the closest to providing benefits to cardiovascular patients?
So, like I said, I think the electrocardiogram and telemetry reading analyses are the best currently, but there's also a lot of good, we see a lot of good evidence and a lot of good performance of AI in contouring and delineation. So, the segmentation of these imaging, basically any medical image, like the contouring and delineation of these, which physicians can do much more accurately, and we can trust them, right? They're physicians, they have years of training. But AI can do it much faster and put a lot off of the physician's plate. So even though it's less accurate, it's much faster and can be improved in the future. But I would say the telemetry and electrocardiogram readings, because they're just like the rhythms, right? They're like the waves. So they can read those a lot quicker because they're more less complex. So yeah.
Gotcha. And you concluded your presentation kind of highlighting that we need more increased research in improving existing algorithms.
Yeah.
So what are the next steps for you now that you've completed this part of the project? Will you continue to build upon this? Are you going to kind of pivot and look at different kinds of algorithms? What's next for you?
So I'm currently I'm working in a lab. So we're trying to use AI and different drug delivery systems to actually solve some problems. And so what I'm actually kind of leading into is cancer and how this can impact cardiovascular health. But I'm also going to start like on my own time and like maybe in some internships or things like that, start advancing more into how specifically these algorithms work, and if I can create an algorithm myself. So different things like that, like it's still such a developing field that honestly I don't even know where to go, right? But the future will hold definitely some interesting things. So, yeah.
Got it. Awesome.